Welcome to the webinar on bringing long-term stability to the childcare market, effective workforce and subsidy policy strategies. My name is Romuald Tassin, and I am a research associate at APHSA, the American Public Human Service Association. This webinar is part of the National Association of Welfare and Research Statistics virtual event series. My colleague Meg Daiger and I will facilitate this webinar. We are hoping to have an engaging session. As we get this webinar underway, I would like to encourage you to share your name, your title, your agency in the chat so that our speakers can have a sense of the audience. If you have any question, please enter them in the question box and the panelists will address them at the end of the presentation. Now, I would like to briefly introduce our speakers. Gina Adams is a senior fellow at the Urban Institute and the director of the Low Income Working Family Project and the Children and Youth Initiative. Lisa Rowe is a research associate at MEF, and her portfolio include early childhood, K-12, and post-secondary education. Marley Michi is a research specialist at the University of Virginia, and she focuses on early care and educational policy, particularly state and local effort to increase access to high quality care for vulnerable children and family. Before we start, I'll be spending a few minutes to frame today's conversation by assessing the current state of the child care in the US. But before I do that, I would like to provide the opportunity to Lauren Antello, the co-chair of the NARS Virtual Event Committee, to give some opening remark. Lauren, please go ahead.
Thank you so much, and good afternoon, everyone. I'm Lauren Antello. I'm a senior advisor at the U.S. Department of Health and Human Services in the Administration for Children and Families, and the co-chair of the NARS Virtual Events Committee. I'm so pleased to welcome you to bringing long-term stability to the child care market. This is the second session of the 2022 NARS Virtual Series. NARS, the National Association for Welfare Research and Statistics, is a nonprofit association whose purpose is to promote the exchange of ideas on how research and statistical analysis can contribute to the development and administration of effective human services programs. We hold in-person conferences every other year where human services researchers, practitioners, and policymakers can come together to talk about their work and how it can inform policy and practice. Stay tuned for information about our conference coming up in 2023. Several years ago, NARS began holding these virtual events in the off years when the conference wasn't occurring, as a way for our community to stay connected and learn about emerging research and trends relevant to this work. You can sign up for a listserv at nars.org or follow our Twitter feed at NARS Workshop to learn about our virtual events last season and our last one of this year, a conversation on engaging people with lived experience in human services programs, which will be held on October 17th. So on behalf of the NARS board, I want to thank APHSA, Romuald Tassin of APHSA, who's a member of our virtual events committee, for his leadership in designing and facilitating this session. And a special thanks to my co-chair of the virtual workshop committee, Asaf Glosser of MEF Associates. And finally, of course, a special thank you to our panelists for their willingness to share their expertise on this very important topic. I'll now pass it back to you.
Thank you so much, Lauren. So the child neuroscience literature tells us that most brain development occur from birth until 5 years old. Against that backdrop, early childhood education plays a significant role in that learning process. In the US, an estimated 11 million children younger than 5 years old are enrolled in some type of childcare arrangement. On average, those children spend 36 hours a week in childcare, according to the Childcare of America. In addition, childcare is also an economic support intervention, as it allows parents of young children the opportunity to work and to contribute to the economy. When we think about the childcare system in the US, what's the best way to describe the existing system? It is fair to say that the current childcare system is both complex and also fragmented. It is fragmented due to the existing structural barriers, primarily in demand, supply, access, quality, and the childcare workforce. Allow me briefly to unpack some of those challenges. When it comes to demand and supply, the existing childcare market in the US has limited access, especially in rural area. And we're talking about some childcare desert. Additionally, the current system does not fully serve the needs of family who work non-traditional hours. If you look at the data, 1 in 5 families with children under 13 work non-standard hours. But unfortunately, the option for childcare is quite limited. When it comes to access to childcare, so the primary public investment in childcare is the Child Care Development Block Grant, and Gina will talk more deeply about that later on. But it was surprising to see that childcare providers that accept those subsidies has declined over the years. From fiscal year 08 to 29, about 60% decline in those providers accepting such subsidies. And the largest decline has taken place for the family care providers. When it comes to making childcare affordable, what is the estimate cost of childcare? So the Childcare Aware of America provide us with a national estimate of the childcare marketplace. So in order to account for the variation across state, those calculations take into account the number of slots by age group, and also the number of programs, including center-based and family care center and family child care. So on average, it costs a family $12,000 for an infant to be enrolled in center-based, while in a home-based setting is about $10,000. But on average, the annual estimate cost for childcare is about $10,000. Now, I would like to briefly talk about the pandemic, because the existing structural barrier that I've underlined were exacerbated by the pandemic. So during the pandemic, families and childcare providers have to face significant challenges. The first one was how to navigate the public health emergency and adjust to the health concern posed by the pandemic. Another issue is around the closure of childcare centers. At the outset of the pandemic, at least 9,000 center-based childcare and 7,000 family childcare have closed permanently. The third challenge is around the higher costs and the staff shortage. In the childcare sectors, there has been a lot of turnover. Sometimes the rate can rise to 30%. There are other factors that also explain the turnover in the field, such as job stress, lack of benefit, and even low administrative support. The last impact of the pandemic on the childcare market is around the women labor force participation. I will elaborate on that in a few seconds. But one interesting dynamic of the pandemic is that there has been a big shift when it comes to childcare arrangement. Before the pandemic, center-based childcare was the primary option for families. But now, family childcare centers has emerged as one of the promising options for families. Now, lastly, going back to the effect of the pandemic on the women workforce participation. So this graph here shows the unemployment rate of women over the last decade. As you can see, when the pandemic hit in 2019, or 2019, the women unemployment rate stood at 3.3%. But when the pandemic actually hit in 2020, the unemployment rate climbed to 8%, more than double the previous rate, pre-pandemic level. But the good news is the unemployment rate has declined, but it still hasn't reached its pre-pandemic level. Now, what about the childcare workforce in particular? In this graph, you will see the childcare annual wages over the last 2 decades. As you can see, it hasn't changed that much. The most recent data from BLS, the Bureau of Labor Statistics, shows that a childcare worker on average, makes $27K annually. Now, how does that compare to other related fields? So this graph here shows the earnings of childcare workers in comparison to other fields like preschool teachers, preschool kindergarten, or teaching assistant. This graph tells us the childcare is the lowest earning categories. So with all of that, so it's pretty clear that the childcare market in the US is fragmented. Now the question is, how can we bring some stability to the childcare system? The use of subsidies, primarily the CCDF, is a promising strategy. With that, I will turn it over to Gina to talk more about how the subsidy can actually shape the childcare market system in the US. Gina.
Thank you so much, Roland. It was a great laying of a good foundation for this conversation. Let me share my screen, and then I will get started. Everybody see that well? Is that okay? We good? Okay, I'm going to assume we're good. Somebody will tell me if we're not. So I really appreciate the opportunity to talk today. And what I was asked to do is to try to kind of provide some context for the conversation, to really think about early childhood funding, particularly childcare funding, and the strengths and limitations in terms of the questions we're asking around stability and dealing with the crisis that we're facing as a field right now. So my goal today is to talk about, provide an overview of the system. I think we'll talk a little bit about what it's accomplishing to address the challenges that Roland laid out so well. Some of the inherent limitations that we face in the system in terms of addressing these challenges, including around supporting the workforce. A little bit about how it works and for whom, so we can understand the role that it's playing for families, and then a brief discussion of implications. At the end, I also have some selected resources. I do want to say is that this is pulled from a lot of different sources. This is not a single research product that I'm talking to you about. It's kind of based on knowledge from a lot of different places. So that's why I have a lot of resources at the end. So first, let's talk a little bit about, you can call it either Child Care and Development Block Grant, or I'm calling it the Child Care and Development Fund. Those under both names, or CCDF. That's the primary funding that goes to support childcare in this country. There's also Head Start and pre-K, but they mostly are 3- and 4-year-olds, often part day, part year, not designed to support work. There's also 21st Century Learning Centers that support school age, but really the CCDF is the big program that supports kids. This is money that mostly helps parents purchase childcare in their communities. A little bit of it goes to support quality and supply. In 2019, the funding was roughly $11 billion, most of that from CCDF directly, some of it from other funds that states can use as part of the same system. What I'm going to talk a little bit about is what the system looked like pre-pandemic. And there's a couple of reasons for this. One is some of the things that Roman mentioned about what happened during pandemic, a lot of them were short-term. They were big chunks of money to kind of put the finger in the dike to keep the system from crashing during the pandemic. States changed their policies during that time, but a lot of those have been rolled back. There's a huge amount of uncertainty going forward in terms of the demand for childcare. Will people be going back to work? What's going on with the workforce? But the parameters of the program, given that Build Back Better did not pass, that there was not a significant influx of new money into the CCDF, which folks were hoping for with reconciliation, the overall parameters of what the system looked like in 2019 is still pretty much true. Leaving aside for a moment the enormous uncertainties about the future, which we all know exist. So what does the subsidy system do on the good side? And I'm going to say this first because my profession is to focus on ways that we make the system better. So I tend to focus a lot on the problems, but I think it's really stopped to think about what it is doing really well. So in the average month in 2019, about 2 million children were in childcare paid for fully or partially by CCDF. It's a lot of kids. Now, these parents were able to use childcare they wouldn't otherwise be able to afford, allowing them to work, to look for work, to attend education and training, do the kinds of activities they needed to support the families. About 2,500 providers received payments to care for these kids. And these were kids who otherwise would be unlikely to be able to enroll. For many providers, this might be the only source of public funds that they're getting. The rest of their funding is going to be coming from private paying parents. Let me say a few things here. One is that in that 2 million kids are there children ages 0 to 12. I think we often talk about early childhood. It's a big focus on the young years. This is a system that supports childcare overall. Childcare needs don't disappear just because a child goes to school. About 45% of the kids in this system are school-age kids. And I think it's really important to not forget that, because I think we somehow gotten blinders, and that part of the world has kind of disappeared from a lot of the policy conversation. these providers, Ramon mentioned the decline. I think it's important to note that part of that decline is in the number of providers who are currently serving kids in the subsidy system. And probably a chunk of that change is moving from home-based care, which serves relatively few kids, to center-based care, which serves a lot more kids. So if you have 100 kids, you can either have 5 kids in a whole bunch of 5 childcare homes, or you can have all 100 kids in one center. That's going to lead to a decline in the number of providers who are participating. It's very complicated to try to unpack how much of that is due to the decline in family childcare overall, changes in parents' preferences, changes in policies that may push parents towards centers. We don't know, but it's an interesting point to make about the providers. But the bottom line is there are a lot of providers in this country who do get some money from the system. We have found pretty clearly in research that subsidies have an impact on maternal employment and on child poverty. So we know that providing subsidies does help people go back to work. The research is a little less strong in this space, but it's also obvious that it also helps support providers by helping pay for some of the kids in their care. So bottom line is this is a really important system for the millions of kids and families it's serving, and it provides some very essential resources. So that's the good news. The bad news, the big one really is that the funding is only sufficient to serve 1 in 6 of those eligible. So there's 52 million kids ages 0 to 12. Only 12.5 million of them are eligible for this program under federal rules, and only 2 million get it. Another way of looking at it is Romo mentioned that 11 million kids are in paid care. Only 2 million kids get it. So you can see that the portion of kids getting help is very small when you think about the overall population of kids in care. So the result of this is really that childcare quality and cost is largely driven by a private market. Most childcare is paid for by parents out of their own pocketbooks. It's limited by what parents can pay. Despite those costs that you saw, that's not enough to support good quality care. Parents can't afford to pay more. So the private market functions to really limit quality and shape supply. So it doesn't support more expensive care, like higher quality care or infant and toddler care. It also doesn't particularly support care that doesn't have really concentrated or stable demand, like non-traditional hours or kids with special needs. So the private, we're largely reliant on a private market and using our CCDF funds to help parents access that market. So it's an existing market, it supports providers in it, but it's really hard to use that funding given the scope to fundamentally change that market, because most of the money in the market is driven by what parents can afford to pay. It's likely to have more of an impact when funds are really concentrated or targeted, which I think is some of the models you're going to be hearing about later by our other presenters, but only as long as the investments are sustained. If those investments are taken out, then unless something else steps in, like philanthropy or the state funding or somebody else, scholarships gotten from somewhere, that provider is not going to be able to recoup that money from other parents to be able to keep that system going. So I think that's one of the most important points to understand. And it's a really important point to understand when you think about the COVID funding, because a big chunk of money went in, but not clear that that's being sustained. And as that leaves, there's a big question for folks as to what's going to happen. And states were very reluctant to put that money into things that would make long-term structural changes in the market, because they weren't sure that that money was going to continue moving forward. So that's the largest issue that I think to be aware of, is that in some ways the subsidy system is the tail on the dog. It's not the dog. People think that it can somehow change things. It can change some things in targeted ways, but fundamentally the private market is pretty dominant. So let's look briefly at the subsidy system itself and how it works, so you can understand when you think about all those parents and what they're needing, who's getting it and who's not. So the first question is, who's eligible under federal law? And the answer is basically under federal law, you have to have income below 85% of state median income. You have to have a child younger than 13. You have to be working in school or training or looking for work. And those are kind of the fundamental requirements. That's the 12.5 million kids that I mentioned before, is how many people fit under that. But who actually gets it is another issue. And these are the various policies that take you from that 12.5 down to the 2 that get it. First of all, state eligibility policies and priorities. Some states actually set their eligibility at lower levels than the federal level. Some prioritize families. So in theory, you're eligible, but you're not going to get it. So in many states, priorities given to families who are employed, much lower priority for families in education and training. So you see a very small proportion of families in education and training getting services. Who knows about it? Not much reason for states to do outreach because they can't serve everybody who needs it. So kind of who gets it is the people that usually come in the door. There's issues about who can get it through the application process. States have not had a lot of support to improve their administrative systems. So there's complicated applications. There's kind of what kinds of requirements you have. It's a devolved system. So states are all over the map. Do you do it in person? Do you do it online? Do you have to, do it over the telephone? Do you have internet access? So all of these policies in each state can shape which subset of people can even get through the application process. Then there's a set of questions about what kind of care can they purchase once they get it, and does it meet their needs? And there's a couple of big issues here. One is because of that overarching lack of money, states are having to make trade-offs all the time. I mentioned one a minute ago. If you have two parents at the door, you serve the parent who's employed or the parents who needs education and training to get a better job. Most states choose the employed. So you trade-offs always. One of the big trade-offs is that states do not pay a lot for care. They survey what parent providers charge. They choose a cap at how much they're going to pay, usually at a fraction of, only part of the market will get in under that. And that's what they'll pay. So providers have a choice of accepting what the state pays, taking a loss, not serving kids at all, asking parents to pay the difference if the state allows that. So what you are losing, you're getting a lower rate that the state's paying, allows them to serve more kids, which is great. But it means that the highest cost providers are not going to be in the system probably without taking a loss. So that means already you see some constraints over what kinds of care providers can get. And for a whole set of complicated things that I'm happy to talk about in Q&A if people want to know, most states don't support really small, like relative care providers, other providers that may be exempt from state licensing. That is the main form of care that families use when it comes to things like non-traditional hours, unstable hours, perhaps in rural areas. It's complicated, but it's something that we also think that's what parents want. In some recent work we've done, when you talk about non-traditional hours, they kind of want to have their kid in their own bed, sleeping with their own stuffies, not someplace else. So that whole group of providers is not supported by most states, which means that families can't get a subsidy to pay for that kind of care because the state won't accept that kind of provider. So that means chunks of the families can't get subsidies to pay for the care that they need to support their work. So let me just wrap up by saying, what does this mean in terms of the really good framing that Romuald gave us about the market? One is, if we want to have a system that's going to meet the full needs of the full range of families who need childcare help to work, find work, education, and training, we need two things. One is we have to have enough resources to make sure that we can meet the need and allow states to not have to make these trade-offs. And second, we need policy and practice changes to make sure that the current approaches don't limit access for some families over others. And similarly, when we try to think about how we're going to do something to meet the needs of childcare providers and staff and those workforce wages that Romuald laid out, we need to make sure that we have enough funding to reduce the role of private market forces, which are fundamentally going to limit how much we can pay people overall. Again, targeted strategies, as we'll hear about in a minute, can make a difference for those providers who get it, but it's not going to do something to change the whole market without significant resources. And second, we really need to be thinking about how do we open up those resources for the full range of providers, relatives, home-based providers, school-age providers, a set of folks that we're not doing as good a job of serving. So I'm going to turn it over to Lisa to talk to you about what they have found about the workforce strategies. Thank you very much.
Great, thank you, Gina. Let me share my screen. Great. So I'm going to shift a little bit towards talking about the workforce itself in the childcare and early education field. I am going to be talking today about the Building and Sustaining the Childcare and Early Education Workforce Project. We call it BASE. This is an active OPRE funded project. And I just wanted to begin by acknowledging the members of our team who've been collaborating with us on this project, as well as the topical experts we've been engaging throughout. So today I want to give a brief overview of the project and discuss two knowledge review activities that we've accomplished to date, a literature review and environmental scan, and then provide some, highlight some key cross-cutting themes that the team identified through this work. So the BASE project has two main goals. The first is to increase knowledge and understanding of factors that drive workforce turnover in childcare and early education, and to build and evaluate evidence on current initiatives underway to recruit, support, and retain qualified workers at state, local, and provider levels across the country. So this graphic here shows some of the key components of the project. We're currently nearing the end of the first phase, where we've been reviewing the knowledge base through literature review and environmental scan, among other activities. We've also been conducting secondary data analyses and have begun exploring opportunities for additional research, including potentially conducting an evaluation of specific workforce strategies. So before we dive in, I think Gina made a really good point about defining who we're talking about. So I think we want to just, before I jump in, I wanted to make sure you all kind of understand who I'm talking about today. So childcare and early education educators and the workforce, and by that we mean kind of current and prospective educators who are paid to care for young children from birth through age 12. So not just those the youngest children, in home and center-based settings. And this includes different positions such as administrators, directors, lead teachers, and then family child care providers, as well as different settings like Head Start, subsidized childcare, licensed and license exempt home-based settings. So we have focused our attention on primarily licensed settings. Also, by workforce dynamics, which is another term that I'm going to be using, that encompasses entry into, exit out of the childcare and early education field. And for those in the field, their tenure and advancement, and entry and exit into different roles, settings, and types of care. So between the literature review and environmental scan, we kind of collectively, the goals for these two activities were for us to learn more about the evidence base for factors that can influence workforce dynamics, and strategies aimed at sustaining and building a qualified CCEE workforce. We also were wanting to learn more about strategies that are currently underway to support recruitment, retention, and advancement of the workforce. So in the environmental scan, we first identified the breadth of strategies underway nationally and categorized them at a high level. And through our scan, we identified 144 strategies that we then screened. So these strategies generally focused on targeting one or more levers of change, or kind of a point at which you can kind of change the workforce dynamics at play. Those include educator qualifications and competencies, educator economic well-being, so income, wages, benefits, things like that, educator psychological well-being, workplace job demands and supports, so things kind of at the provider level, factors at the provider level that can influence the workforce, and then system alignment and inequities, so kind of those that are focused on aligning different elements of the system at a larger level, including data systems alignment, parity, in terms of supports that are provided. So this is kind of an overview of some of the strategies we included in our scan. Most of the screen strategies target economic well-being or qualifications and competencies of the workforce. Where we've been able to identify the setting of interest, there's a relatively even split between strategies that serve workers in center-based and home-based settings. Most strategies are aimed at supporting and sustaining the current workforce rather than channeling prospective members of the workforce into the field. There is also a relatively even split of strategies focused on administrators versus teaching staff. And just as a reminder, as you look at this, the categories are not mutually exclusive, so a strategy can fall into more than one of these. As a second step, we identified a subset of 38 strategies that we reviewed more in depth and discussed with key informants. This subset was purposefully sampled and selected to be representative of the different types of strategies underway that target those different levers of change. So now I'm going to hop into highlighting a few key themes that we found across literature and environmental scan. And I wanted to also highlight that there is a forthcoming brief from our partner at MDRC on some of these themes. So first major theme was that the field really needs a common language and consistency in measurement of workforce dynamics. Terms like retention, turnover, and advancement are not consistently defined and measured across literature. For instance, turnover is measured in different ways. Some studies looked at whether an individual left their center or the field, whether a family child care provider closed their business. Some studies capture an administrator's report of turnover at their center. And other studies also look at individuals' reports of their intent to turn over, leave, or quit. In our literature review, many studies that looked at what factors were related to turnover used educators' intent to stay or leave, which, it's unclear how well intent actually maps to actual turnover. So there's also a lack of clarity in terminology in the environmental scan. We found those same themes there. So these differences in available data and sometimes the lack of detail on how these aspects were measured makes it challenging to draw some definitive conclusions about patterns of workforce dynamics. To truly be able to compare two different turnover rates, we need to know who's included. Is that just lead teachers, assistant teachers, both? Over what length of time did the turnover occur? And whether, how they're defining turnover in terms of whether it's out of a particular employer, a setting, the type of care, or the field entirely. So if these details are not reported, then we won't know why two rates may be different. There are a variety of strategies aimed at recruitment, advancement, and retention, but only a few studies use experimental or quasi-experimental designs. A few studies show that strategies promoting educators' economic well-being or their qualifications and competencies can lead to reduced turnover or more advancement. A general lack of strong causal evidence about strategies makes it difficult to identify if those who access interventions are more likely to advance or stay in the field than other educators who don't rely on these strategies. And also questions remain about what strategy components are most critical for reducing turnover or promoting advancement. There's also a need for a longitudinal understanding of workers' employment pathways, including where educators come from, how they advance and move between settings, and when and why they leave. Much of the current literature focuses on a single point in time, and relatively little focuses on where educators go when they leave and why they leave. Some qualitative research suggests that center-based educators tend to leave for higher paying jobs in another center, in an elementary school, or outside of the field. And for home-based childcare providers, they may leave because of stress related to running a small business. Longitudinal data and in general, and specifically for educators participating in different strategies, would allow for the field to understand workforce dynamics over time and within the context of a strategy being implemented. Overall, there was also, a potential disconnect between the focus of existing strategy and the constellation of factors found to affect turnover. So while low wages is an incredibly important factor that I think most folks who do research in this space would acknowledge, research suggests that there is, it's not the only factor. Other factors include stress and burnout, lack of preparation prior to entry, lack of work supports, discrimination, difficulty working with children with challenging behaviors, and for home-based providers specifically, the burdensome paperwork and requirements for following regulations in order to be licensed. The environmental scan found that existing strategies do not always consider that there may be a constellation of factors at play in individuals' employment decisions. Some strategies may even target one lever of change at the expense of another. For example, a strategy may provide tuition support to an educator, but require full-time employment, therefore exacerbating their workload. This suggests that strategies aimed at multiple levers of change may be more effective than strategies that target one. The workforce, the CCE workforce is comprised predominantly of women and people of color, yet there's limited research on the unique strengths and needs of educators who are members of historically marginalized groups. The limited research there finds evidence of discrimination, racism, and bias. For example, Black and Latina educators earn lower wages than white educators. There's also evidence that the returns to experience in education are lower for Black and Latina educators. There's also some evidence that the educators who engage in strategies from educators from historically marginalized groups, tend to drop out of strategies at higher rates than their white counterparts. The environmental scan also found that existing strategies might not do enough to ensure individuals from marginalized groups are able to access and participate in strategies. For instance, very few of the strategies we dug into targeted or tailored their supports beyond providing materials in Spanish and English. Finally, much of the research examined predictors of retention and turnover focused on individual and setting level influences like individuals' economic well-being, psychological well-being, and educational factors, as well as perceived working conditions. More research is needed that examines the effects of community level factors like the local labor market, local poverty rates, the supply of childcare, and systems level factors like state regulations and policies. The environmental scan found that strategies often define problems they're trying to address from a systems level perspective. When asked what problem a particular strategy is trying to target, informants often cited factors like chronically low pay, worker shortages, labor market competition with retail and service jobs, and high regulatory barriers for family childcare providers. However, the majority of strategies then propose solutions at the individual level that don't seek to change the system surrounding this. So, this disconnect may have implications for the sustainability of some of these strategies and long-term effectiveness. So overall, the literature review identified several factors at individual and setting levels that appear to be related to workforce dynamics. The strongest evidence is for the influence of wages on turnover, but in general, the research suggests that wages are not the only factor. The findings, also point to the promise of strategies that can help build a stable and qualified workforce. There's some evidence for the effectiveness of strategies focused on economic well-being for reducing turnover. And some of these same strategies also show promise for improving credentials and qualifications. So in the next phase of the BASE project, we'll be aiming to identify opportunities to build up the evidence base of strategies and those factors that drive workforce dynamics. Wanted to provide contact information for the co-PIs on on the study, and then also our project officer. Awesome. I'm going to stop sharing and I will hand it off to Molly.
Hi, everyone. I'm going to start sharing my screen. Let me know if you don't see it, but I am essentially here to provide an example of one of the economic well-being strategies that Lisa was just talking about. So this one comes to us from Virginia, where my team is based at the University of Virginia, and I'm with Dr. Daphna Basak's team, the study of early education through partnerships. And what I'll be presenting today is from joint work with her, Dr. Basak, and Justin Dormal and Vivian Wong. And this is a brief that we have published on our website. So obviously you are welcome to check it out in full. But this is a study that we were able to do in Virginia on an exciting financial incentive program that they piloted in 2019. So that program was initially called the Teacher Recognition Program. It is now called Recognize B5. But in 2019, they started off a set of efforts using the preschool development grant funds that they received. And part of that was they used almost $3 million of those funds to pilot this innovative early childhood incentive program. And the goals there were to support early educators' economic well-being, like we've been talking about, to reduce turnover, as Lisa was also mentioning, and then also, in turn, to improve learning opportunities for children by increasing the stability of the care that they're experiencing. So this was a program where teachers were eligible for up to $1,500 in financial incentives if they remained at their specific preschool development or PDG registered site as part of the pilot program over an 8-month period. And the teachers who were eligible included aides, assistant teachers, lead teachers, really anyone working directly with children. And this was limited to younger children, so children under the age of kindergarten enrollment. And the teachers who were eligible had to be working 30 or more hours per week with those children. So we were able to be sort of really involved in the planning process for this program. And we were excited to be, as the evaluation team, there to help people think about what we could learn from the program. And sort of two main questions seems like they would be really well answered by this pilot program. And one was just, what does turnover look like in Virginia and the early childhood workforce, which is something we haven't been able to look at before. There's really limited data in the early childhood space, as I'm sure most of us know. And so we were going to be able to look at this because our partners would be verifying the teacher's employment as a way of ensuring that they were still eligible for this incentive program. So they did that at 3 time points over the pilot year, ending December 31st, 2019. And then the other big question that is sort of the slightly more exciting one is looking at the impact of the financial incentives. And we were able to look at this really rigorously because in one large urban county, they were interested in participating in the PDG and all of the initiatives, including the teacher recognition program, but there were insufficient resources to be able to include all of them in that county. And so the state decided that in order to allow the county to participate, they would be doing a lottery to assign sites to whether they would be eligible for the teacher recognition program or not. So there were 75 sites with up to 600 teachers, and at the sites that won the lottery, teachers were eligible for up to 3 payments of $500, so a total of $1,500. And in the comparison group, the teachers were just not eligible for the teacher recognition program. So a really clear contrast, and it enabled us to do a randomized control trial. And to start off, I just want to give us a sense of the sample in this study. I think a lot of this is going to track with what Gina and Lisa and Romuald have told us about the early childhood workforce, but in this one county, we're seeing similar things. So across the sectors, the childcare centers and the school-based programs, we are seeing a big difference in race and ethnicity of the educators. They're overwhelmingly white and as lead teachers in the school-based programs, and much more diverse in childcare centers and in the assistant teachers in school-based programs. So a lot of what I'll be showing is based on this sector difference and then also this role difference, so the lead and assistant teachers. And I do also just want to note that family day homes, which is what they call home-based childcare in Virginia, were included in this program, but due to sample sizes, they're not included in this study. So again, just a few more demographic things here. We also looked at their experience and education, and here you can see sort of the huge differences jumping out at me are the fact that 100% of lead teachers in school-based programs have a bachelor's degree, and that is much less in the other groups here, especially in childcare centers and assistant teachers. So that's a big difference, and that obviously has to do with the way that those school-based pre-K programs are run. And then again, similar to what we've been talking about, there are just huge differences in pay. Again, mostly when you compare the lead teachers at school-based programs to lead teachers in childcare centers, making half as much money. So huge differences there, which as you might expect, are going to have different implications for how much $1,500 means to them. So the first question that we asked was just sort of what does turnover look like in Virginia? And at the end of the 8-month period, we were able to look at that and see that it is very high. So it's about 18.5% across the different sectors. And that is the percent of teachers who left their site during that 8-month period. And we comparing that to Virginia K-12 rates, I think it's about 10.5% over the whole school year for K-12 teaching. So it's a big number for early childhood folks. And again, there are big differences by sector and by role here. Much higher turnover in the childcare centers than in the schools, and assistant teachers are also turning over at higher rates than lead teachers, which again tracks with pay as well. Okay, so the next graph here is similarly set up, and it's sort of our big reveal of the impact of the financial incentives. Here, the green is the control group that did not have any eligibility for the teacher recognition program. So no one in that group received $1,500. And the blue is the teacher recognition program folks. So they were eligible to receive the $1,500. And then this is showing the difference in turnover rates. So big gap here. And you will probably notice that the biggest gap is in the childcare centers. So it truly cut turnover in half at the childcare centers that had access to the $1,500 for their teachers. And in the school-based programs, there is really no difference at all, which might make sense given the huge difference in salaries that we were showing, and just how much $1,500 can make a difference when you're making $35,000 versus when you're making in the 70s. So based on these results, we wanted to dig a little bit deeper into the childcare centers and look at a difference by role there. And again, we see sort of what we might expect based on the salary difference, and that is that assistant teachers are even more impacted than lead teachers in childcare centers, really just huge impacts on them. And I also just wanted to share a little bit about what the recipient teachers wrote about the program. We were able to do a survey a couple of months after the program ended. So once they'd received all of the payments, and ask what the program meant to them and how they spent the money. And I always like to sort of share some of their voices about how important the $1,500 was for their lives. They talk about being able to pay for medical bills and housing, to take time off of work when they needed to if they didn't have enough paid time off. And they also talk a lot about feeling really valued for the work that they do that, in the past they have not felt valued for given their low pay. and standing in society, a lot of them mention as well. So really impactful and exciting to hear about. I will just end with sort of a overview of where the teacher recognition program has gone since 2019. Based on these findings, the state was able to concentrate resources on the center and home-based providers. So given the null results on school-based teachers, we were able to concentrate the resources on the other sectors. And also our partners at the Department of Education were able to lobby the General Assembly for more funds to be able to increase the amount given to each teacher over time. So it is now $2,500 this year, and it'll be going up to $3,000 next year. And I think we'll talk a lot more about this in the discussion, but as everyone has been mentioning, this is sort of like one short term, although you know, our partners are very serious about making this a sustained commitment so that programs and teachers can feel like they can rely on it. But it is sort of, you know, an injection of funds directly to teachers that's not through other systems, and it's not, you know, a more systemic overhaul. So at the same time as we're working on those, it's exciting to see these results of direct payments to teachers. And I will just end with some resources here too, that I think you'll get these slides and can click on these links, but we have the brief summarizing our findings and then some information from the Department of Education about the program. And our website has lots more findings from that partnership work as well. So I will pass it back to Ramul for our question and answer session.
All right. So thank you, Gina, Lisa, and Molly for your insightful presentation. So we're going to start our Q&A. I will encourage the audience, if you have any question, please put them in the Q&A box. So I would like to start with Gina. So Gina, you talk about the need to increase access to subsidies to help family have access to childcare. And then we also know that the pandemic has also very shaped how family are accessing childcare. So my question to you is, how did investment in childcare through the COVID relief funding help CCDF agency expand and better serve families?
So thank you for that question. So there's kind of two big things. One is that during the pandemic, states did a lot to try to make it easier on providers to not lose as much money and to make it easier for families to stay in. So the two big ways they did that, for example, was a lot of states historically have paid providers only when the child shows up. It's attendance-based. Unlike any of you on this who've listened to this call who've ever paid for childcare, you pay for the month. You don't just pay for the days your kid goes, right? But the state often, they'll pay a certain number of payment days, absent days, but they will pay normally based on attendance. So during the pandemic, many states said, we're going to pay based on enrollment, so that the provider knew that they, even if the kid couldn't come because of the pandemic, that they'd still be able to get the resources. States also sometimes really relaxed their eligibility requirements for example, essential workers. So those kinds of things made a difference in terms of just making sure that families could easily access the subsidies. Some families could access the subsidies, and even if they couldn't use it full time because of the lockdowns and the unlockdowns, the ins and outs, that families could still know that slot was available for them when they could go, and the provider knew that they could get paid. So that was one piece. The other big piece, which happened in a different part of it, was there was a significant investment from the federal level for grants to providers, because as I think you mentioned in your opening comments, it was like a perfect storm for the provider world, right? It was I won't even say it was a foundation. It was already a very cracked foundation that we had, and the pandemic just broke it. So you had higher costs, PPE, lower ratios for particularly the 4-year-olds, which is where a lot of providers are able to get a little bit more resources to pay for the babies. So you had much higher costs, lower ratios, higher staff drain, less people attending. It was this kind of mix. So there was a focus during the pandemic of a chunk of that money was to go direct grants to providers to help them just keep on paying their staff, keeping their doors open, or just staying alive long enough for the system to come back. So that was critically important. I do want to say, though, that was an incredibly important finger in the dike. It was not addressing these longer term issues that I think we've been talking about. So super important, fabulous that they did it. But it is not necessarily addressing these longer term issues, because now many states are rolling back those policies that I mentioned. Those grants are going to be over. The pandemic relief money is going to be over. This is part of the reason why the childcare field was so incredibly excited about the prospect of Build Back Better. And then they were very excited about reconciliation resources coming towards them, because they know that we have much bigger systemic problems that need resources, but none of that came through. So there's a big concern about what happens moving forward.
Thank you so much, Dina, for your response. So I would like to shift to Lisa. So it was, interesting, when you provided a very good, assessment of the existing, strategies when it comes to the childcare workforce. I was kind of surprised that when it comes to the psychological, well-being of the childcare workforce, there was only like 5, promising or existing, strategy. If you look at one of the reasons, why there's such, high turnover is, mostly, embedded in the stress that is associated, with the profession. So I'm just eager, can you talk a little bit more about some of those strategy that you came across when it comes to addressing the mental health of the childcare workforce?
Yeah, no, that's a great question. I think we had that as well, kind of surprised by the lack of strategies that were focused in that area. I think, one thing that came up in the literature review was that, we found some strong associations between that like stable work environment in terms of like knowing, stable classroom assignments, just that stability. It's important for children, we know that, but it's also important for the workforce, but also just facing, challenging classroom behaviors. So I think a lot of the strategies we found, the few strategies we found in that space were really kind of focused on addressing the needs of both children and the workers. So, one example was this really intensive social emotional learning workshop that was really focused on helping to build skills for the worker to address those challenging behaviors. But then it also included like one part of the workshop was focused on the psychological well-being of the educator themselves, because that's also important for the well-being of the children in their classrooms. So a lot of those are really embedded into their teaching practice, I think is where we saw that often come up. And then also, there were strategies focused on those job demands, one focused on job demands for family childcare providers, trying to lessen those burdens on them in terms of, regulatory requirements and trying to keep their business afloat. And that was kind of, so it was less focused directly on that. It was kind of indirect. Yeah, that's kind of where we saw it show up, which, like I said, aligns with the literature that we found in terms of where you might have the biggest impact.
Thank you, Lisa. So now, Marley, so your findings, of the effectiveness of this initiative in Virginia is really appealing to me. But I'm curious, did you see any variation when it comes to, how this program has affect the childcare, the teachers across, a demographic line, like you said earlier, that the white are mostly predominant, in the profession. I'm curious if those affect, vary across racial lines and demographics.
Yeah, that's a great question. And it's not one that we have had time to look into specifically, but I think, just given the breakdown across the sectors, it's pretty clear that the educators of color are the ones making the least amount of money. And so therefore they're being impacted the most by being able to receive the incentive.
Yeah, sounds good. So once again, for the audience, if you have any question, please feel free to, use either the chat or the Q&A box. So I want to go back to Gina. So given what, you described, in your presentation, what could make a difference in our ability to ensure providers have the core resources they need to pay higher wages?
So I think, obviously the big one is money, right? I mean, it's like, if we don't, as long as we're relying on the private market, it's just not going to be sustaining wages over any large set of folks. Until we have that, if I want to be optimistic and say we will have that at some point, then I think it's the kind of thing that Molly's talking about, Lisa's talking about, which is identifying the set of providers or the communities where the private market really, really doesn't work. And the providers, the workers for whom it really doesn't work, and figure out very targeted ways of sustaining that. So part of it, if you're thinking about the subsidy system, and I'll try not to get too down in the weeds, but the subsidy system is largely a voucher system, which means that the money follows the child. So the parent can go to this provider today, and if they change their minds, they go to someplace else. So that means that you may not want to be attaching any kind of effort to support providers or pay to that system, because that's going to depend on a child going there. And there's a bunch of providers that may serve, 1, 2, 3, 4, 5 kids, but may still be in communities with very high needs or be serving particular populations. So thinking about identifying providers where you want to provide kind of more sustained, targeted kinds of strategies, or workers, as Molly's, the Virginia model example. But I think that's one thing that I also was really struck with what Lisa said about the importance of thinking more systemically, and thinking about things like job quality, thinking about context, thinking about where you're going, thinking about how you're treated. Unfortunately, I think a lot of those problems do come out of a historic disinvestment in this field. It is not highly regarded. It is not something where people, like I actually was a childcare provider when I was 18. And even at 18, I knew that that wasn't going to be a field that I could ever make a living in, right? I mean, as much as I adored taking care of children, I chose something else. So I think part of this is a larger set of issues, but I think we need to start with the resources and to start thinking about some of these job quality questions, some of these larger kind of systemic supports that I think would be really interesting to have Lisa maybe answer that as well, kind of from her perspective. What are some of those beyond compensation? What are some of those things that might address some of the more systemic questions? Because that's really, I think wages are a big one, but as she said, it's not all of it. So I don't know if I can just pass the baton over to Lisa and Molly on this question, but I'd be curious as to their insights.
Yeah, I think I think we've been thinking it as wages and, there's, like you mentioned, Gina, it's kind of it's a field that is not given the respect that it deserves, I think. It's not given the same attention, supports, investments in people progressing through it, like you might see in, say, the K-12 space. So I think, there are a lot of, interesting strategies that try to combine multiple things at the same time, like an apprenticeship where you are building skills and knowledge in the field, as well as kind of having some some commitment from your employer to have increased wages. So it kind of melds those two different things together. That was a lot of where we were seeing kind of interesting promise. I think I also wanted to address Mary's comment in the Q&A about kind of, you know, which of these strategies could really be invested in to help make kind of systems level changes. I think one thing we found, like Molly was suggesting, even Virginia, the great work that's happening in Virginia, there's no guarantee that the funding is necessarily going to come every single year. And so a lot of it is just, you know, a lot of these strategies are new, doing really interesting things. You know, found a lot are quite new. A lot of the efforts that are underway are quite new initiatives, but they're lacking consistent funding. Some were saying they were scrapping together funding from 8 different places. You know, they just listed off all these foundations and things. And it's hard for people to reliably make decisions to stay in the field and choose to enter it if they don't know that those supports are going to be there when they get there. So it's really backing some of those existing strategies that are out there and making sure they have consistent streams of funding to do the work that they're doing. They're doing great work. It's just the need to really make sure that they're always there for everyone as they come into the field. Is that kind of answering your question, Gina, too?
Yeah, if I just add one thing, and I don't know if Molly has something to add, but, you know, I remember one time talking to somebody who's focused a lot on the workforce, and she said, you know, unfortunately, I think we have to pay this through bonuses rather than through raises. And I said, really? And she said, yeah, because a bonus people don't count on. A salary raise they count on. And so if you can't say that you're going to be able to pay that next year and the next year, because people, when you have a raise, they start paying mortgages based on this. They start, you know, making the educational decisions for their kids based on this. So a raise means you have to know you're going to come through. A bonus or a supplement like you're doing in Virginia, that's like a gift, and it doesn't necessarily factor in people's long-term sense of their ability to pay bills. I thought that kind of broke my heart, right? Like, you want people to be able to know that they can, you know, make educational decisions for their kids or buy a house or whatever based on kinds of supports we give them. But if we can't, it's almost, I don't know if this is true, but it seems like it's almost worse to give somebody something and then have to take it away. And I also think there's some really interesting questions that I want to raise about equity within programs, because there's different wages sometimes for infant and toddler teachers than for 4-year-old teachers. Like, if you give this person a raise, but the teacher moves to a different place. So, you know, these Band-Aid approaches are really important, but they don't solve the problem, and they can create other inequities. Like, I was thinking, Molly, in your site where you had a random control group, right? I mean, there were teachers in program A that got that bonus, and there were teachers in program B that didn't. Right? What does that do for the teachers in program B? Right? There's larger issues on these decisions that, again, go back to, do we have enough money in the system to actually support people the way they need to be supported? So anyway, I'm dominating too much. Molly, I don't know if you had thoughts to add to this whole blend.
No, I mean, I think I agree with everything you're saying, that like the Band-Aid approach is hard to count on for everyone, which makes it, thinking back to what you were saying about when you were 18, like, you know, you wouldn't think, okay, I'm going to go into this profession and then maybe I'll get a bonus, so it'll be great. So it's also not doing a great job of attracting people or making it seem like a more respected field for society either. So definitely, you know, as excited as we are about giving money to teachers now, we also really are pushing. I think our team is very focused on the money side of things, just as like the most concrete way we can sort of improve well-being for teachers, as well as stability for kids, and really like sort of improving salaries as a way to improve other aspects of well-being and sort of like respect from society and that kind of thing.
Yeah, you know, I really like, you know, how, you know, you are framing, you know, this discussion as a way, you know, to look at a system at the, you know, holistically. It also, you know, remind me that one other aspect is about, you know, benefits. So wage compensation is one bucket, and then there's also the, you know, the idea about, you know, benefit, because it seems to me that, you know, if you look at the childcare, you know, workforce, you know, one of the reasons behind a very high turnover is, this, lack of benefit. I'm just curious, do you guys came across any, promising, strategy or how can we address, that layer of, the structural problem that undergird, the childcare system?
I mean, benefits also are a cost too. So I think from the employer's perspective, if they can't afford benefits, they can't afford benefits to provide them. I think there was one, I know this is happening elsewhere, but I know in Washington State, they've funded their Affordable Care Act, their marketplace, to essentially provide subsidies for folks in licensed childcare settings to access health benefits. So essentially taking that existing kind of state level system and providing targeted subsidies to folks in the field. And that, and it's really quite in depth, where they're providing a lot of technical support on folks who maybe have never been part of formal healthcare before or anything. So, and providing it really in all those different languages of the providers that are working in the field. So yeah, that was kind of one, I think, that stood out to me. And I know that work, it's not just happening in Washington State. I know a few other states are doing work similar to that.
I also just want to mention, and I just want to apologize, folks, I forgot to put up the resource slide, but I think this paper is in that resource slide and we'll send it out afterwards. We did a piece actually in the beginning of the pandemic to saying, what are the range of ways that we could be supporting providers? I mean, supporting the workforce, because there's lots of different ways. And one of them is thinking about benefits. And I think that example Lisa is exactly right. I mean, states have programs that they do to give benefits to some people, state employees, whatever, thinking about opening that up. This is kind of a sad one, but really making sure that every childcare provider who's eligible for SNAP, for Medicaid, for any of the public assistance programs is on it. And I hate to say it, but a lot of them are eligible. So doing a really systematic outreach effort. I mean, anything that can improve the resources that go into people's pockets, that don't just count on the CCDF, which is a very underfunded system, as I laid out, and only a very small proportion of that underfunded part goes to support quality and supply. So thinking about other state resources that are going to other kinds of folks, these are workers, these are low-income people, these are et cetera. So I think that there's a range of ways that we could be thinking about marshaling resources in other ways to support folks. So that's just, I think that's in the slides, and I'll make sure that folks have access to that.
How about you, Marley? Is that something that the Virginia folks are thinking about? So, or is just like, are they just focusing on the compensation side of things, or are they broadening the scope of things that they can provide to shape the?
Yeah, so I think that the state folks in Virginia are thinking about compensation, including benefits, in the way that they are trying to work towards just having sites be able to be well funded enough that they can provide good compensation, salaries, and benefits to their teachers. I think, again, that's sort of this struggle of like the way that they're doing it is through CCDF at this point. They have created an alternative payment system so that they'll be able to pay higher rates starting, I think, in like 2 days on October 1st. So that's exciting. But as Gina's saying, that's also limited. So their strategy is definitely to try to, at the same time as offering these direct payments to teachers, to be funneling more money into the providers that are accepting childcare subsidies, and that ideally that would mean that those providers are able to pay for benefits for their teachers. And I think, I feel like we're all just saying that there's not enough money in the system, in the existing streams. And I was thinking about that in terms of the, trying to get teachers on SNAP and TANF and all of that. Like that also feels to me like it's super important in the immediate term, but it's also obviously not the ideal that we would have an impoverished workforce that needs to rely on these systems. So we pretty much end every brief we write with like, there needs to be a huge public investment because it's a broken market and we don't have enough public funds to make sure that providers are able to have good, stable workforces that are filled with, teachers who are well paid and doing well and able to really provide the best care they can to the children as well.
Thank you. Let's see if there's any question in the chat or in the Q&A. I don't see any. All right, and then I'm also, curious to talk about, cross, sector collaboration, because it seems to me that if we are trying to address some of the challenges, that hinder, access to childcare and addressing the childcare workforce challenges, there might be some opportunity for the early childhood education to collaborate, across, different sectors. For instance, when it comes to the issue around, mental health, how can they, collaborate with, public health and mental health. And then also on the issue of funding, there's some interesting case study on how the childcare agency are leveraging their resources with, for instance, TANF. In the case of Washington, they have, developed, what they call a wage ladder, like, where they provide an increase to wages, based on educational level, year of experience, and the scope of responsibilities. So I'm just, curious to hear your input on how we can better align, system, the early childhood education with other system as a way to, address all of the challenges that we discuss, here today.
I guess I feel, and I feel kind of overly negative saying this, but I think it's really important. And I think there's a lot that needs to be done in that area. It does sometimes feel to me like we're rearranging deck chairs on the Titanic, right? I mean, the mental health system's not well funded, early intervention is not well funded, TANF's not well funded. I mean, none of these systems are well funded. So we cannot, it's kind of like what childcare state agencies have to do, which is like, do I serve a whole bunch more kids with less good care or fewer kids with better care? Do I, serve this family on TANF or that family on TANF? Or do I take this mental health service away from this kid to provide? So I think it's important, but I still go back to none of these systems have the resources necessary to meet the needs. So it's important and valuable and well worth doing. And there's stuff there that folks can learn from, but I still think, I remember going to Mississippi years ago and talking about coordinated services, and they looked at me and they said, you have to realize we do not have those things to coordinate, right? I mean, you're assuming that we have that mental health person that can come to the provider and do that kind of training for them. So I think it depends on, can you access it? Is it available? Is somebody willing to fund that to happen to be brought into this system? But maybe I'm overly negative and Molly and Lisa have more positive reactions to that question, which I think is, I would love it if that could fix it. So
I think my reaction is maybe negative too, because I went to only the sort of family access side of things, that like those are places where, as you were saying, Gina, like given the limited scope of subsidies, like it does matter who's able to get in the door. And so like thinking about ways that states can prioritize within those different ways that families get connected to systems, and sort of advertising that way is where my brain went with that question as well.
I think I'm probably equally pessimistic, but I think my head went to some of the, I feel like some of the really creative ideas that have come out are really coming from like nonprofits or philanthropy. Some of the really creative approaches I think that we saw through our scan were kind of not, they're really, I don't know, they seemed a little more experimental or, you know, I'm trying to think of an example. I think, you know, when you said cross-sector, I was thinking of a private business that kind of helps coordinate childcare providers who are wanting to market. It kind of provides a marketplace, but one thing that they do help, one system level issue they do help solve is that families don't always need care at the same time. People don't always need 5-day-a-week care, and they might need it at different hours and different times, but it's a lot of work for a business to try to line up all of the children they're serving to maximize their slots that they have available in their license. So it, you know, one of the things they provide is to help try to line up demand with the supply that each individual provider has. And that's like a very niche problem, but it does impact the availability of care that kind of meets everyone's particular needs. So there's a lot of kind of, I feel like interesting things happening at that level that there is a role that I feel like government agencies could play in trying to help provide that sort of coordination or provide support for those efforts. So I think that's where I went, is there were some really creative approaches that I think we saw that just weren't at scale quite yet.
If I could just add one thing, because I was too negative, and that was helpful, Lisa. We have done a lot of work thinking about how do you simplify access? How do you make it easier for family, reduce paperwork, reduce hoops you have to jump through, which can be good both for the agency and for the parent, right? So there are efficiencies. There's multiple systems that can be regulating a provider, that if we could align those and make that simpler. So I think there are redundancies in the system, there are inefficiencies in the system that would both free up resources and make life easier for both workers and parents. And we've done work on that I'm happy to share with folks, but I don't think it solves the big problem, but it certainly could help make progress, and it would make everybody's lives happier. And it also potentially would create more equitable systems, because the people who have to jump through the most hoops, who are going to have trouble with that, are the folks who may face the most challenges, right? So if you can simplify that process, you're going to create a more equitable system where the folks who face challenges are more likely to be able to get through it. So I'll end on a positive note.
I think I just want to note that, like, also from the provider side, when they're scrapping together funding from like 12 different, you always hear these terms of the magical term of braiding funding. And it's like, it's not a, you know, it's not like a pretty cute thing. It's a complicated thing that you like can't quite get right, and you're always trying to fix. And so I think if there were work done across programs to try to align them at that level, instead of putting the onus on the provider themselves to kind of make it work and scrap those sources together and meet all of the requirements, that would go a long way.
Sounds good. Unfortunately, we're out of time, so I would like to thank Gina, Lisa, and Molly, for sharing their insight. So we will circulate the deck after this webinar, and then stay tuned for any upcoming NAS virtual event series, which will continue throughout the year. So once again, thank you for all our attendees, and have a great rest of your day. Bye-bye.